and welcome to the Health Wrap by The Hindu. This is, in video format, everything that you can learn about health on The Hindu's website, the newspaper, and its e-formats. Through the Health Wrap, we will try to bring you analysis, stories from different corners of the country and the world. We'll also bring you a great deal of explainers and basically point you out to health news that you can read on our website. Do not forget to wait until the end, where we have an expert bringing you some tips that you can follow on a day-to-day basis. Today, joining me in this first Health Wrap is Zubeda Hamid, who is also with the Health Desk. Hi, Zubeda. And today we'll be bringing you the key developments during last week, the end of last week and early this week. So I think the main thing, Zubeda, wasn't it the fact that we got so much health data at one given point of time? I don't think it's ever happened before.
Absolutely, Ramya. There was a wealth of data that was released last week and early this week. One of the most important reports that came out last week was, of course, the fact that we had 21 lakh excess deaths in the year 2021. Which was a pandemic year. Why don't you tell us a bit more about it?
Yeah, that's a staggering amount of deaths. The Hindu, in fact, did a number of analysis over a period of time to try and establish, without our regular sources, try and establish the excess deaths that had occurred as a result of COVID. And the WHO had a much higher estimate, but this 21 lakh deaths is higher than what the government initially told us.
Yes, it is. That was the year of the Delta pandemic, the Delta wave of the pandemic, as I'm sure a lot of you remember. It was a devastating wave that swept its way across the country. It's also worth noting that because of the lockdown, there were far fewer people on the streets at that point in time. And so I think we should be able to attribute a large number of these 21 lakh deaths specifically to the pandemic. The government, however, doesn't seem to agree, does it?
Yeah, but frankly, it doesn't surprise me. Did it surprise you?
No.
So the government is saying that these were not just COVID deaths, and they've listed out the other reasons, causes for the deaths. But my argument is, if you have all other things remaining common, the inability of people to get outside of homes, and even, it brings down the number of causes for deaths substantially.
Yes.
So what else could it have been? So that's my question. But then the Indian government was very happy when the Human Development Report came out, because that said a lot of glowing things about India's HDI, particularly about longevity.
Yes, India has moved up in the Human Development Index in the report released by the UNDP, and it has been attributed to the national health programs that have been run by successive governments across the country. It also pointed out that we now have an average life expectancy that has increased considerably since independence. We are now at upwards of 70 years. And another whole bunch of data came out from the the sample registration system.
Yeah, that's also very key. It gives us the true data. It gives us the data of how India lives, basically. So that is where we get our original data for the country on births, deaths, maternal deaths, infant mortality. And there seems to have been some improvement, hasn't there, over the years?
It's been good news. Our maternal mortality ratio has gone down. Our infant mortality rates have gone down. And we are doing well in terms of saving lives of babies and of children under 5.
And it's by and large a southern states part of the country. But then, we lead this country. So that's as much as we did in terms of large news last week. But that's not the only thing we did. We also have a huge offering on the site and on the paper. So, Zubeda, do you want to talk about one or two?
One interesting thing for those who are interested in tracking non-communicable disease news, one of the major reports that came out last week was that the discovery of a new subtype of monogenic diabetes.
Yeah, this is quite interesting. Over the past few weeks, we've been hearing of different types of diabetes emerging, things that we've never heard of before. But this particular one is about onset in children.
Yes,
in
young
youngsters.
adults, yes.
And this was done jointly by the Madras Diabetes Research Foundation and the University of Washington.
Yes.
And yeah, that's something that we are going to ask our readers to go and check
Do
out
click
on
on
the
those
website.
links to find out more. Another thing, of course, that we looked at was some research that has emerged that shows a new type of drug that can help with both migraines and depression. Sounds really interesting.
Yeah, you bet. And the migraine part actually had me in a vice grip because I have myself, been suffering from migraine
Like
for
so
a long
many
while.
people.
Yeah. I know so many people who have migraines, and apparently depression is a cohabitation. So, check out our link.
One other interesting news item that came last week, and as everybody was so involved last week in watching what happened with regard to the India-Pak conflict, was how is our country prepared for health specifically in times of war?
Yeah, I think that's something that we need to learn because not just the war, but any disaster that occurs, whether it's a natural disaster or a man-made disaster, it's important for us to be updated about what happens, in terms of health, serving the health of the country. We cannot at any point suspend health services. So how do we best serve the nation? So this article has a lot of pointers to that. So I think it's good reading, particularly for health managers and bureaucrats.
Especially as the wars in other parts of the world have shown us, your health systems can go for a toss in
There's
times of
also
conflict.
not conflict, but there's, Kerala had the 7th outbreak of Nipah. And of course, Kerala is pretty, does a pretty quick job in terms of detection, isolation, and even treatment. But then this is something that we'll have to be watching.
Yes, their systems are very well oiled and machined now in order to be able to detect and surveil and treat. But yes, it's worrying that they're constantly experiencing these repeated outbreaks.
Right now, perhaps it's time for our expert segment. And today we have Dr. Rajan Ravichandran, who is a nephrologist and the founder of the Sapiens Trust. He has, over the years, looked at salt consumption as the biggest enemy of people who develop hypertension. So without any further ado, we go to Dr. Rajan Ravichandran. Hello, Dr. Rajan Ravichandran. We are happy to welcome the inaugural guest for our video podcast.
Hello, I'm also happy.
We're going to be observing World Hypertension Day on May 17th. And
Right.
as a nephrologist and even outside as part of Sapiens, your organization, your NGO, the Trust, you've been doing a lot of work with regards to salt consumption in the population, basically looking at lowering hypertension. So would you
Yes.
like to talk about the work that you've done, and then we can follow it up with maybe a couple of questions?
Brief introduction. The number one killer in the world is hypertension and its complications, heart attacks, strokes, and kidney failure. So basically, it is because of the hypertension leading to an endothelial damage to the blood vessel lining that leads to reduced blood supply or clots or whatever it is. So it leads to an organ dysfunction. So the most important cause of hypertension, people are not aware. They still think it is probably stress.
Right.
So stress only transiently elevates the blood pressure. But what keeps a sustained high blood pressure is the salt intake. And Indians are consuming almost 2 to 3 times of the salt which WHO recommends for an average adult to consume per day, which is 5 grams of salt. And Indians consume anywhere between 8 to 12 grams of salt per day. So almost 1/3 of the adult population in India have hypertension if you measure it. But if you don't measure also, you may have a blood vessel damage in a larger group of patients. That's why you see both hypertension, strokes, heart attacks, and kidney failure. We are one of the leading countries which have these morbidities. And realizing the importance of reducing salt in the population, that is the single most important, most cost-effective measure which can prevent the complications of hypertension. And we started this in 2010. We started with, of course, creating awareness by having walkathons in the beach, releasing videos, posters, and subsequently we had the first conference on salt consumption in 2017 with IIT Madras as well as in IIT Mumbai. where we again involved a lot of international speakers to highlight on the importance of salt consumption and hypertension. After that, also we have been writing to food manufacturers, more than 300 food manufacturers, asking them to again reduce use of salt as a preservative for packed or packaged food. And recently, with the resolve to save lives, we have been organizing conferences for physicians. First, what we found is that physicians themselves are not aware on the importance of salt, the relationship between salt and health. I would say not just hypertension, salt and health. And so we had three conferences, one in IIT Madras in June 24, then one in Mumbai in December, and one last month we had it at Delhi. So this is again to educate physicians on the importance of salt and health and how we can recommend to patients to consume less salt.
Right. The recent recommendation to reduce the sodium content, the WHO recommendation to have low sodium salt, replace the salt that we have on our kitchen tables. How effective do you think that will be?
So first, I would like to clarify or what you call misconception, in the sense that a lot of people think alternate salts are salt substitutes. They are not. For example, you have in the market like rock salt or Senda Namak, Indupu, or Himalayan pink salt, etc. All these of them contain still the sodium. So when we talk of low sodium salt substitutes, we talk of a situation. See, sodium is the cause of the ill effect of salt on the blood pressure or the blood vessels. So we have to replace part of the sodium with another salt. And the most important, the cation which has the opposite action of sodium is the potassium. So the low sodium salt substitutes are where potassium replaces the sodium by about 20% or even up to 40%. So you have, instead of sodium chloride, you have part of it is potassium chloride and part of it is sodium chloride. This way you consume less. This is the guideline which the WHO is talking of, is the low sodium salt substitutes.
Right. What about, let's come to diagnostics, doctor. What about testing oneself periodically for hypertension? Do you do it only after a certain age, or is it to be part of your annual
No,
checkup?
I think every opportunity you get, you should record your blood pressure. By that, what I mean is, for example, children, often the blood pressure is never recorded. And in a study we did in college students, we found that 10% of the college students had hypertension and they were not aware. Imagine 10% of young students who are at the age of 16 had hypertension. So it is an issue even in children. So at every possible opportunity, when you go to a general practitioner for some other illness or whatever it is, a blood pressure recording should be made. Same way, while recruiting in jobs or seeking admissions, I'm surprised, of course, when you seek admission to the US, they ask for tuberculosis. They don't ask for hypertension. So, but I think this should be an opportunity at every screening point, like students, when you enter the college or schools, when you are entering a job, a blood pressure recording should be done, or you visit your physician for any other reason. For that matter of fact, what we have been doing is to distribute the electronic blood pressure instruments so that people can record their own blood pressures at different times. This will avoid the white coat hypertension. If they record it themselves at home, the blood pressure may be different than what we see it at the clinic.
True. Can I also ask you, Doctor, to give our readers, our viewers, some small tips that they can follow in life, daily living, so that one can keep hypertension at bay?
So the most important, as I said, the important cause of hypertension is salt intake, obesity, alcohol, and lack of potassium in the diet. So if you look at the opposite actions, so first and foremost is, of course, people should be doing exercise. They should keep themselves mobile. Sitting in one place for long hours obviously is detrimental. So that is followed by obesity. So obesity is another cause. Third, of course, first I would put salt intake. So if you are going to take high salt intake, whatever you do, see at this point you may be salt resistant, in the sense the salt may not, for example, two people eat the same salt. One person gets hypertension, one does not get. So this depends on the genetic sensitivity to salt. So you call it salt resistant. But this salt resistant can change with time. So today you may be salt resistant, tomorrow you'll become salt sensitive. So cut your salt intake. And you may not even know how much grams to take. Just reduce it by 10% or 20%. It's going to make a significant impact on your life. So first and foremost is the salt intake, which consists of avoiding preserved and packed foods and avoiding adding extra salt while eating food. So salt shaker should be removed from the table. Then second is exercise, as I said. Mobility definitely produces a vasodilatation of the blood vessels and an improvement in the blood pressure. Reduction in weight or obesity, mindfulness of your this thing. High potassium intake, very important. You should take fruits and vegetables. So that has an anti-hypertensive effect on the blood vessels. So these are the important tips are to reduce your salt, regular exercise, keep your weight under control, and take sufficient potassium. And of course, last but not the least is avoid toxins like smoking, alcohol. Alcohol is known to produce hypertension. Although the first drink may produce a vasodilatation, over a period of time, alcohol produces hypertension.
Right, and with that, we come to the end of this segment. Thank you so much, Dr. Rajan Ravichandran. We are so glad that you could join us today, and I'm sure our viewers will have a great deal of information from this small conversation. Thank you so much for
Thank you
coming.
very much, and it was my pleasure. Thank you.
Whether would you like to hear a fun fact for the day?
Yes.
I mean, there are so many, interesting health-related information, but they want to hear something about smells.
Okay.
Yeah. Right. Roughly 1 decade ago, scientists discovered that the human nose can detect more odors, smells than it was ever believed. Until then, it was believed that the humans can detect up to 10,000 smells. What do you think is the
10,000 already sounds like a big number.
It sounds like huge, right? But then the revised estimate is that the human nose can pick up over 1 trillion smells. I mean, I have a cold now, so I possibly can't pick up anything, but that's a fun fact for the day.
Oh my God.
Thank you so much for listening in. So do join us for the Health Wrap by the Hindu bi-monthly, and we'll be happy to share more interesting information, stories, and tips from experts. Thank you so much.